Okay, for active range of motion, passive and resistive range of motion for the knee, we're going to start off by doing active range of motion. And in this case, we can do this either sitting or lying prone, so we will do both. So for sitting, Zach can do knee extension, which is just to straighten the leg out. And then bringing it back down is knee flexion, okay? Then for passive range of motion for knee extension, I would just do it myself. So I would just passively extend it, passively flex it, okay? For tibial rotation, okay, there's rotation of the tibia that can go internal and external. So Zach's gonna lay on his stomach for this one. So that way I can show it passively. But what he would do, okay, for tibial rotation, essentially what's happening is the tibia is rotating internally that way and externally this way, okay? So Zachary, go ahead and just try and rotate your leg, your foot, okay, externally and then internally. So you can kind of do it yourself, so that would be active. Now passively, are you watching, Jimmy?
Mm-hmm.
Okay, passively I would rotate the leg inward, and then resistively I would rotate it outward, okay? Now, for resistive range of motion for the knee, okay, I'm gonna show these in a prone position, all right? So for knee flexion, okay, for knee flexion in a prone position, he's gonna keep his knee bent. My proximal hand's gonna be right here at the lower back. My distal hand, now keep your leg up there, okay? My distal hand is going to be on the posterior side of the lower leg. I'm gonna try and push him down. He's not gonna let me, okay? Now, for extension, okay, my proximal hand's still at the lower back, and now my distal hand is at the anterior side of the lower leg. So go ahead and try and push my hand down, okay? That was for resistive knee extension in a prone position. Now, to resist internal and external rotation of that tibia, my one hand, again, my proximal hand is going to be at the lower back. I can rotate his foot inward, and what I'm going to do is tell him to push my hand. Push my hand down. Push my hand down. No, like push my hand down. There we go. Okay. The other way, go ahead and try and push. All right, that was external. All right, so when we're rotating the foot this way and I'm trying to push him down, or externally rotating and pushing it down, what I'm doing is isolating the hamstring muscles, okay? That's the whole idea of doing that resistive range of motion for tibial internal and external rotation, okay? Now, I'm gonna have Zachary turn around and sit down in a sitting position. I am going to show knee flexion and extension in a sitting position for resistive range of motion because it's similar. But in this case, my proximal hand is going to be right above the patella, okay? Now, for him to do extension, my hand is on the anterior side of that ankle. Okay, just like I did when we were laying down. So he's going to push my hand up. Go ahead, push. There we go. Now, this time to do resistive flexion, my hand just moved to the posterior side of the ankle. So go ahead and push my hand back. Okay, so that was just another way of doing resistive range of motion for knee flexion and extension. And again, that was all active, passive, and resistive range of motion for the knee.